former deputy president of the Nigerian Senate, Ike Ekweremadu, is still being held in the United Kingdom jail over allegations bordering on human trafficking and intent to illegally harvest human organs. His case has reignited and sustained the conversation on the legality or otherwise of organ harvest in Nigeria. Dr. Philip Njemanze is of the Global Profile Assurance, and he joins us now for a quick chat. Doctor, thank you so much for joining us on Newsday. We appreciate your time.
Thank you for having me.
It's a pleasure. Now, looking at what's happened with the issue, with the Ekweremadu's case and the legality of organ harvesting, comparing both, how would you say that this should be approached by anyone that's seeking to, that's probably seeking maybe a donor? For instance, let's say I need a kidney transplant, and I'm looking at what's happening with the Ike Ekweremadus with the Ekweremadu family right now. How should I proceed to ensure that I'm ticking all the legal I's or crossing all the legal T's and dotting all the I's?
Well, yes, it is true that the Ike Ekweremadu case has ignited a new phase of conversation on organ trafficking. But the unfortunate thing is that organ trafficking has been legalized in Nigeria. This is very unfortunate. People are not aware that there is a lacuna in what we call the National Health Act. Just to draw your attention to this, so our listeners will follow what we are saying. In Section 53 and even Section 48 and Section 51 of the National Health Act, there are lacunas there that allow people to harvest organs of other people without consent. Let me read out Section 51, for example, of the National Health Act. It says, a person shall not remove tissue from a living person for transplantation in another living person or carry out the transplantation of such tissue except in a hospital authorized for that purpose and on the written authority of the medical practitioner in charge of clinical services in that hospital or any other medical practitioner authorized by him or her. In the case where there is no medical practitioner in charge of clinical services at that hospital, a medical practitioner authorized thereto by the person in charge of the hospital. Now, I read all this. Did you hear the donor? So it is the doctor who is authorizing that the organ of a Nigerian should be taken and given to another person. It's not the donor. There is no consent. And we raised this concern as Catholic doctors at the Senate hearing, public hearing. And we pointed out that this lacuna will allow organ trafficking. And it so happened that Ike Ekweremadu was then, as Deputy Senate President, was presided over this public hearing with Ifeanyi Okowa, Senator Ifeanyi Okowa, who was the main sponsor of the bill. And I remember that Ifeanyi Okowa pointed to me that there is Section 48 of the law makes it mandatory that you must seek consent. I said, okay, let's read Section 48 of the National Health Act. Subject to the provision of Section 53, a person shall not remove tissue, blood, or blood product from the body of another living person for any purpose except with the informed consent of the person from whom the tissue, blood, or blood product is removed, granted in prescribed manner, that the consent clause may be waived for medical investigations and treatment in emergency cases. Now, in other words, if you come in an emergency, nobody needs to ask you for anything. You can be taken to the operation table and your organs removed without your consent. This is what the law permits as set today in Nigeria. The Seventh Assembly of the National Assembly actually committed high treason by allowing this clause to be there. So if you hear that some people took organs of others in any Nigerian hospital today, they have the legal framework in the National Health Act. This has never happened in the history of humanity. And this is a sad thing. So I'm not surprised that a Nigerian will be picked up by anybody here and taken to London or anywhere else trying to take their organ. The unfortunate thing is that in those countries, laws work and they wouldn't allow it in their law. But if that was in Nigeria, this is perfectly in order according to the Nigerian law as of today. And this is an unfortunate thing.
Well, clearly we do need to work on our laws here in Nigeria, but there was a very horrific report in the media this week where two teenagers sold their organs to a medical doctor in Abeokuta, Ogun State, without the consent of their parents. And in the case of the two teenagers, one of them suffered severe complications. So what are the risks of donating one's organs, especially for those that are doing it for financial reasons? We do know that the black market for organ donation is thriving at the moment. What are the risks involved?
Yeah, well, there are high risks for donating any organ. First of all, it requires a proper medical certification. But I will tell you that merchandising in organs in Nigeria today also has a legal framework. And provided by this law, they call the National Health Act, which is a national disaster. Let me read section 53 for you, so you will understand when people merchandise organs that they have a legal framework in Nigeria today. And this is unfortunate. Let me read section 53. It is an offense for a person, section 1A, who has donated tissue, blood, or blood product to receive any form of financial or other reward for such donation, except for reimbursement of reasonable costs incurred by him or her to provide such donations. Then ask yourself, what is reasonable cost when you donate a kidney or a liver or any other part of your body? So this section 53 allows people under so-called reasonable costs to market their organs. So as unfortunate as these events are, if you provide a legal framework, people will use this lacuna to carry this out. And this is what we have been warning the National Assembly on, and it's a real shame for the entire country, for the first time in human history, that you will legalize organ trafficking within a law, a framework of a law in Nigeria. The health hazards are colossal. People who donate their organs face challenges, health challenges thereafter, because you might not be sustained by just going with one kidney. And there has to be proper evaluation even when you are volunteering. Actually, you must volunteer for a next of kin, and this has to be in a prescribed manner without duress or any financial incentive to that. So I think what needs to be done immediately is to remove, actually repeal in wholesome order the National Health Act, because this is what the criminals are looking at. And once this legal framework is there, you cannot stop this. It's already happening.
Well said, Doctor. And one of the things that I found a bit, interesting was that sometimes you see cases of ritual killings, but it's really under situations like this. I'm just wondering what the initial step would need to be in order to have a regulatory body for, organ harvesting.
Yes, the law provides for regulatory bodies within institutions. But this is a wrong framework as it is provided today in the National Health Act. We talked about and we proposed to the National Assembly to have a transplantation law with a regulatory body, an organ, as a separate law. We will need that because the foreigners who are sponsoring this and the so-called ritual killings are just a disguise. They are coming for organs like heart, so which will mean that that person has to die. They are coming for organs like kidney, even your entire so-called insecurity. In most of those areas where there are so-called Boko Haram or bandit activities, and if you look, those victims are losing their organs. Most of the dead victims, their organs are being harvested by foreigners. These are not Nigerian institutions. These are foreigners who are coming into the country, harvesting organs and taking them out for transplantation. And there is evidence to support this. And we are even providing that framework in our laws. Why should it be that we should have a National Health Act that allows organ trafficking? Why should it be so? It shouldn't happen. And I expected that the Buhari administration should by now take the initiative and repeal the National Health Act, because it is a useless law. A law that says in Section 20, if you arrive at an emergency, you can be given free emergency care. Well, it sounds good, but immediately you declare that emergency, your organs can be taken without your consent. And what the foreigners want is to establish hospitals all around Nigeria so that they can be harvesting organs, because they have the legal framework. We have offered every Nigerian, regardless of status, whether poor or rich, we have offered all Nigerians as involuntary donors in the country. And this is a national disgrace. And we must take action against the entire National Assembly that passed this law, even when they knew the truth. Because I pointed them out. I pointed this out to them, along with other doctors, and I spoke to Ike Ekweremadu before over 5,000 Nigerians, and to Ifeanyi Okowa before over 5,000 Nigerians. So they should know that this law is treasonable, and they should not allow this law, because this is what is actually giving rise to all these things you're observing in the country. And it will never abate until we repeal that law called the National Health Act.
Oh, Dr. Philip Njemanze of the Global Profile Alliance, thank you so much for joining us to have this very important discussion. And we do hope the authorities are listening and will take action. Thank you.